you very much. Good morning, and thank you for inviting WHO to give a presentation on WHO strategies to increase the voluntary, non-remunerated blood donations. And I wish great success of your two-day workshop. So I will present on the need for blood and blood products, the importance of voluntary non-remunerated blood donation, the global situation, and the challenge. All has assembly resolutions on blood donation, WHO strategies on voluntary strategies on increasing voluntary non-remunerated blood donations, and also a little bit progress over the past 20 years in the world in increasing VNRD in the world. First, the need for blood and blood products. The need of blood is universal, but the pattern of blood use is different in developed and developing countries. In high-income countries, blood was mostly used for support care in cardiovascular surgery, transplant surgery, massive trauma, and the therapy of solid and hematological malignancies. In low and middle-income countries, a significant proportion of blood is used to manage pregnancy-related complications and severe childhood anemia. For example, those anemia caused by malaria. Also, the need for blood transfusion is evolving. It increases with changes in population, demography, disease pattern, medical advance, better diagnosis and treatment options. And also, it increases when the health service expanding to cover more areas of the countries. Need for blood transfusion decrease with the effective implementation of a disease prevention program or the implementation of a better or appropriate blood use program. Evidence have shown that the VNRD is the foundation of both blood safety and for sufficient blood supply. This is still true in countries where very sensitive laboratory screening has been implemented. VNRD is also crucial for safe and secure supply of blood. Its importance in ensure secure and sustainable supply of blood has been proved by the experience in many countries during COVID pandemic. Countries have a strong national blood donor program based on voluntary non-remunerated blood donation in cooperation with countries which mostly rely on family replacement donations were more likely to effectively overcome the various restrictions caused by the pandemic and are able to collect blood from donors to meet the clinical need. This slide summarizes the global status of blood supply. You can see that there is a big difference in the donation per 1,000 inhabitants in different WHO, in different economic groupings and WHO regions. And globally, 60% of blood are collected in low and middle income countries, which is the hope of 80% of the world population. In general, in high-income countries, there is a high proportion of VNRD among the total collections. And lastly, around 50 countries in the world send plasma collected domestically for preparation, or collected or prepared domestically for fractionation, with the volume per 1,000 inhabitants ranging from 0.1 to almost 53 liters per 1,000 inhabitants. This slide shows the map of the donation rate per thousand population. There are 60 countries in the world that reported collecting less than 10 whole blood donations per thousand population per year. This includes 34 countries in WHO Africa region, 4 in the region of Americas, 5 in the Southeast Asia region, 4 in the European region, 4 in the Eastern Mediterranean region, and 9 in the Western Pacific region. This slide shows the proportion of donations given by voluntary non-remunerated blood donations by World Bank economic grouping and also by WHO region. In general, high-income countries had a higher proportion of blood collected from VNRG. When we analyze the data by WHO region, the proportion of voluntary non-remunerated whole blood donations varied from 50% in the Eastern Mediterranean region to as high as 95% in European region and 98.7% in the West Pacific region. This slide shows the proportion donations given by repeat voluntary non-remunerated donations. Perhaps this indicator can be regarded as one of the indicators to show how strong or how less strong the national blood program. You can see that in WHO's European region, the median proportion is 90% repeat VNRD, with the interquartile ranging from 68 to 93. Other WHO regions have a relatively lower percentage. So in summary, the challenges in war on the voluntary non-remunerated blood donations included the lack of safe blood donors and a lower blood donation rate, especially in low-income countries. A weak voluntary non-remunerated blood donor program, dependence on replacement or paid donors, inadequate system for assessing donor suitability for blood donation, lack of quality donor service, care and counseling, lack of competent staff for donor recruitment and management, lack of facilities and equipment. And concerns are that as the population ages, need for blood increase, but the number of donors decrease. Through World Health Assembly, the ministers of the member states in the world has passed several resolutions on blood and transfusion safety. The earliest one is WHA 28.72 on utilization and supply of human blood and blood products, which was adopted in 1975. The two more recent resolutions are WHA 58.13, establishment of all blood donor day, and WHA 63.12, availability, safety, and quality of blood products, which was adopted in 2005 and 2010, respectively. So this is the WHA 58.13 establishment of World Blood Donor Day resolution. You can see that this resolution not only agree to the establishment of a Blood Donor Day as an annual global event, The resolution further urges member states to implement and support well-organized, nationally coordinated, and a sustainable blood program with appropriate regulatory oversight so that sufficient safe blood can be collected to meet the needs of a patient, which usually a prerequisite for a country to increase the collection from voluntary non-remunerated blood donors. This slide shows some images of the Blood Donor Day. WHO has been marking the World Blood Donor Day every year since 2004. In fact, every year we WHO and its partners, especially the International Federation of Blood Donor Association, ISBT, and International Federation of Red Cross and Red Crescent Society, where I identify a focus slogan, and for in the past 20 years, almost every year, also identify a host country to celebrate the day, to coordinate the celebration of the day in the world. And the campus focus on thanking blood donors who save lives every day through the blood donations, and strongly encouraging more people to become a donor. And as I just mentioned, in the resolution, World Blood Donor Day is also an opportunity to promote the global blood and transfusion safety strategy and the importance of universal access to safer blood transfusion. In the middle of this slide, you can see that this year will be the we will celebrate the 20th anniversary of World Blood Donor Day. So we have already working with the partners to establish the slogan for this year. It's 20 years of celebrating, giving, thank you, blood donors. In promoting voluntary non-remunerated blood donations, in 2010, WHO issued a global framework for action to achieve 100% voluntary blood donation, which was developed jointly with the International Federation of Red Cross and the Red Crescent societies. It is designed to provide guidance and support to countries seeking to establish effective voluntary blood donor program. In addition, WHO developed guidance on assessing donor suitability for blood donation to assist the blood transfusion service in countries that are establishing or strengthening a national system for the selection of blood donors. WHO also developed implementation guidance on blood donor counseling and guidance on established national hemovigilance system, in which a donor vigilance system was also discussed. Global database on blood safety was established in 1998, and a global status report provides the global monitoring for the status and the progress in blood safety and availability. So this is the different language editions for the WHO action framework towards 100% voluntary donations. I'm happy I'm just listening that the previous speaker has already mentioned this action framework, and I'm especially happy that actually in Saudi Arabia you have already start to develop the national action framework or national strategy, and starting with the understanding of blood donors. I think that's really the purpose of WHO having this global general action framework as a roadmap for the countries to adopt. So the action framework includes 4 strategic goals and with 20 strategies. So the first strategy is to create, establish enabling environment for 100% of voluntary donations. Strategies include obtaining government commitment and support, establish a national program, and establish a strong partnership and with the stakeholders. The second strategic goal is to foster a culture of voluntary blood donations. Strategies include develop effective communication strategies, including effectively using media and social media, and organize the celebration of World Blood Donor Day and maximize the impact of the celebration of World Blood Donor Day and the national events. The third strategy goal is to build and maintain a safe, sustainable voluntary donor base. Strategies include educate and motivate new donors, mobilize young donors, convert family replacement donors to voluntary donors, recall, retain, and recognize blood donors, like the event many countries organize during World Blood Donor Days. The fourth strategic goal is to provide a quality donor service and care. Strategies include make it convenient for donor to give blood, reach out to the donor through mobile session, provide a high-quality donor suitability assessment and donor counseling, provide a good quality service to blood donors, and make a donation really a pleasant experience. This slide shows the program, a training for trainer program on developing national blood donor program, which is we call a donor. This has been used in the past to help countries to build the capacity on donor recruitment and management, often in collaboration with FRC. In 2020, WHO launched the action framework to advance universal access to safe, effective, and quality assured blood products 2020-2023 to guide WHO work in the past few years. The action framework has 6 strategies. And for strategy 3, 4 high-level outcomes. Expected outcome has been identified. This includes 2 which are relevant to the increase of collection of blood and also plasma from voluntary non-remunerated blood donors to meet the need of the countries. So with the adoption of a resolution and the development and the implementation of strategies and programs, maybe we want to ask, or we want to know, has the world made progress in increasing voluntary non-remunerated blood donations? Based on the global status report, or based on the data reported to WHO Global Database on Blood Safety, overall, an increase of 10.7 million blood donations from voluntary non-remunerated blood donors between 2008 and 2018 was observed in the 119 member states for which data for both years are available. An increase of 12.3 million total collection from all types of blood donations were observed between the year. By WHO region, except for Europe, in which a marginal increase was observed from 2008 to 2012, and then a marginal decrease from 2012 to 2018, all WHO regions reported a trend of increase in total whole blood collections from all type of blood donors and donations collected from VNRD. This slide shows the number of paid donations reported to WHO over past more than two decades. You can see that there's at least the reported data show a decreased trend of the number of collections collected from paid donors in the world. I think this is also an indicator of the progress in the world. This slide and the next two slides, I just want to show, based on the global database on blood safety, the progress, the steady progress over the past more than 10 years. The collection of blood from a voluntary non-remunerative blood donations. So this includes Laos People's Democratic Republic, Namibia. You can see that the general trend is shows the steady progress. And this slide shows Rwanda and Sri Lanka. This next slide shows the progress in Vietnam. And it's actually studied from a system which mostly based on paid donations to now today almost mostly collected from voluntary donations, and also the total collection increased significantly. And the country have an objective by 2020, they should achieve the 2 per thousand population, 100% voluntary non-remunerated blood donations. We are now start to collect data from the country, or we see whether this goal has been achieved or not. So what are the factors that contributed to this steady progress? Well, we have not done a formal study or evaluation to answer these very important questions, but I think multiple factors must be behind this steady progress shown by the data. Perhaps this includes government commitment, government investment, and usually plus some external technical or financial support, and most importantly, the existence of a nationally coordinated blood service in the country. In fact, as far as I know, Namibia, Sri Lanka, and Vietnam all have a significant transformation or reform of its national blood system during some stage in the past 20 years. I believe this should be a very important common factors that contribute to the progress in increasing voluntary non-remunerated blood donations in these countries. Thank you very much.